Thanks for coming, everyone. Most of you know who I am. I'm the chiropractor downstairs. My name is Dr. Michael Yoon. Those of you who don't know me, nice to meet you, but I know everyone here. Today, this afternoon, the reason why you're here is we're going to talk about supplementation and nutrition. And I do believe that it is a very important component of healing. And having good nutrition is very important. But the key thing is why do we even talk about nutrition? Why is it so important? And the reason why it's so important is aging, process of aging, okay? How many of you ever heard of chronological age versus biological age? Chronological age is when we celebrate birthdays every year. We get older as each year goes by. Biological age is how our body is aging. So a person could be 60 years old, but they may still function like a 40. A person could be a 20-year-old, but their body may be looking like 50 or 60. So even though the age is actually increasing, some people actually age well, where others may age improperly. And that has a lot to do with also nutrition. Nutrition is very important, okay? In our lifetime, we are living longer and longer, okay? So for instance, in 1796, average lifespan was about 25 years old, okay? And that time, that was considered norm. By 1896, it doubled. At 48 years old, that was the average. By 1996, 80 is kind of like the standard. By 2050, everyone is expected to live about 120 to 150. So our lifespan is actually increasing. So what does that mean? Why are people actually living longer? It's because of preventative approach. Nutrition, supplement, hormone therapy, exercise, mind and body, and self-care. I'd like to actually show this a very example of how the body is. When we're younger, we tend to be right up here. When we don't have any gene problem or any disease process, our potential is right up here. Potential meaning it's like a boulder on a rock. All it requires is a little push and it creates that momentum. Now, as we get older, we tend to develop some injuries, traumas, so our potential starts to get lower and lower and lower with time. The thing is, some people say, well, you know what? I remember when I was a young kid, I used to be very flexible. What is it that I need to do to keep limber? Some people are very proactive thinkers. They think ahead. So they kind of look at where they want to be and they reverse engineer it. And they do things like taking care of their body, having good nutrition, taking care of the body. And then eventually, as they get older, they still kind of keep within this realm. And then when they get older, still active elderly people who's enjoying the world, enjoying their retirement, going skiing, going on a trip without any challenge. But there are other people who are so busy living their life and they don't really think about taking care of their body. And eventually, as they get older, they start to develop a lot of problems and develop some chronic illness. Now, I've seen people who are in kind of like a senior citizen group in the nursing home, and they're lying down and just kind of waiting for their time to be done. And there are some people who are at that same age, just traveling, enjoying life. So I like to think of it as, I really want to be at this stage when I get older. I really don't want to kind of be at this stage. Now, there are some inspirational people in my life that I look up to. The inspirational people that I look up to are not a 15-year-old, 17-year-old YouTuber doing 5 flips and going all these stunt crazy. I'm like, good for you, you're young, you can do it, but hopefully you take care of yourself so that way in the future you can walk. But people who inspires me are people like this gentleman. This is my dad, okay? He's 85 years old. He's a martial art grandmaster. He's been training since he was 3 and 4 years old. He's done a lot in his life, but he does a lot of things to take care of his body, such as exercise, nutrition, and way of life. This elderly lady, this is my wife's grandma. She lived up to 101. Even at her age, she had full memory, but she had routine. She knew when to wake up, what to eat, what supplements to take, what kind of treatment she should get, when she should sleep. These two people I don't know personally, but this gentleman is 99 years old and still running marathon. 99 years old, can you believe? A lot of times people who are in their 40s, they're like, my knee hurts, I can't run. This gentleman, he's 75 years old. He's bodybuilding every day, taking care of himself. His body looks like he's only 35. Okay, so what does this tell us? And what are these things? What are these people doing to keep themselves healthy? It's a proactive approach. Now, commonly held theories of aging. First, wear and tear. Second, hormone theory. 3, genetic. 4, free radical damage. So let's kind of go through that. So first one is wear and tear. The theory goes is when you use your body over and over again, eventually your body becomes not new, it falls apart. So as we age, we are doomed to get problems. We're gonna have arthritis, we have knee problem, we got mental problem, we have all sorts of problems because it's part of aging. Some people truly believe that. However, I don't think that this is completely true because it really depends on environment. If you're in an environment where it's toxic, you're in an environment where everyone's negative, you're in an environment where they don't believe in exercise and self-care and bad food, yes, this is gonna happen. But what are some of the solutions? Habits. Habits of diet. Protecting against also sunlight damages from overconsumption, such as alcohol and some of the things that some people may enjoy. We need to have in moderation. Second theory is neuroendocrine theory. What does that mean? Our body is controlled by hormones, growth hormones, testosterone, okay, estrogen. Now, they say that when we're younger, these hormones are at the peak, functioning optimally. But as we get older, our hormone starts to kind of drop. When it drops, our body doesn't heal well, we doesn't recover well, our muscle mass reduces, which is true. Self-care. If you overindulge in bad food and cause toxification to your body will not function. Secondly, the solution is taking supplements to help stimulate your hormones too. It's very, very important. Third, hormone therapy. And there's also hormone therapy that's actually prescription-based, but also based that's bioidentical, which is more natural. And they do that up here, which is actually pretty cool. Another thing is genetic control theory. I'm born with certain gene, so therefore I'm gonna have a problem no matter what. There's nothing I can do. Now, if you see the graph on here, this is a chart of dementia. There is a gene that actually at birth, you're born with that certain trait and certain gene that controls about 65% that cannot be modified. So what about the 35%? Such as education. If you have less education, that increased 6%. Hearing loss, hypertension, obesity, again, contributes to dementia. Okay? Later in life, smoking, depression, physical inactivity, isolation, diabetes. So these things all counts for 35% that a person can control. Let's say they didn't do any of that, then their chance of getting dementia is 100%. So what I'm trying to say is nature versus nurture. Even though we are born with certain traits that's predisposed to certain problem, what we do in our everyday life also affects and influences and prevent these problems from happening, okay? A good example is skincare. I mean, we're upstairs in the skincare center. Did you know that only 17% is genetics, which is age and gender and genes? Now, 33% is environment factor, how much sun you get exposed to, the climate, the pollution, the water, the air, and 50% is exercise, nutrition, the amount of sleep you get, okay? Emotional well-being, and also routine to keep yourself healthy. So when you actually add lifestyle factor, which is 50%, and 33%, 83% can be controlled by that person, where 17% is genes, okay? So I know that we're not completely talking about skin, but skin is a good example. Skin is actually your biggest organ. Now, I'm a guy, I get facial upstairs once a month. I take care of myself because I know as I get older, I'm gonna have some skin problem. I'm gonna have oxidative stress. So as a chiropractor, I know that I need to take care of my structure, but why not take care of my skin? Because that's the first impression when you see someone too, okay? Free radical theory. What this theory says is whatever you eat, it creates a byproduct. and byproduct is oxidative stress. So when we're eating food, it actually metabolizes to make us alive, but it creates a exhaust, just like a car. When you burn fuel, it creates exhaust fume and it causes damage. So how do we stop that from happening? Well, we can't, but we can control it by taking proper antioxidant supplementation to improve and prevent damage to the cell. So a healthy body is attained by these factors. 1, nutrition and supplement, which we're gonna talk. 2, rest and passive care. I've seen people who exercise regularly. They're like, I don't need to take care of myself. Look at me, I'm very strong. I exercise every day, but their body is falling apart. They're not getting proper rest. 3rd is exercise and being active. 4th is mind and stress management, okay? I always say, you can actually exercise the body, but if your mind is disturbed, it also affects it. And then 5, being around healthy environment, healthy social circles. How do we measure health? There's 4 things that I think that we can measure. First is structure, your skeleton and your muscles, okay? If you see a person and their body is kind of like this, what would you think? They're healthy or they've got a problem, right? Your frame. 2 is integument, skin. You look at their skin. Is it dry, dehydrated? Do they have a lot of age spots? Do they have pigmentation? Do they have a lot of wrinkles? Skin counts a lot. Are they glowing or are they dull, right? Number 3, cartilage and joints. How's your wrist? How's your knee? Do you have a bow leg? Do you have a cartilage wear and tear? Number 5, hormone system, their metabolism. Are they overweight? They can't lose weight? Are they lethargic? Do they develop certain kind of adipose in different areas that's related to hormone? So these are 4 things that we can actually see a person just visually and say, that person's healthy, that person's got some imbalance, okay? Now, who here drinks water? So try not to drink water off tap. Drink filter water, spring water, or a lot of the fridge has filtration system. Do that. Put it in the, okay. Also, drinking enough water is very important. For men, about 2.9 liters per day, which is about 12 cups. For women, about 9 cups. Now, some people say, I don't like the taste of water. I don't want to go pee too much, so therefore I don't drink water. Our body is 80% water. We need water to flush it out of the system, okay? And coffee is not water, by the way, okay? When you drink a lot of coffee, people say, I drink coffee, it's water. And goes, it's actually diuretic. It takes the water out of your system. Now, when we're drinking water, it's good, but there's something called electrolytes. And this typically causes, if you don't have enough electrolyte, it can cause dizziness and kind of almost a seizure, that kind of feeling, okay? So a lot of times, like long distance runner, marathoners sweat a lot and they start to lose a lot of electrolytes. And so especially in the broad sunlight, people don't really cover their head, go golfing and they're sweating. You may be losing quite a bit of electrolyte. That also causes problems as well. So balancing electrolyte is very important because electrolyte helps with metabolism of sugar, which we're going to talk about. Now, recommended food guide states that you need to have about 3 to 5 servings of vegetable per day and 2 to 4 servings of fruits per day. The only thing is this actually shows you as a kind of like a not optimal, but just to kind of keep you alive. Plus, they also said that they don't see the difference between fresh fruits and vegetable versus canned. It's very different. You have canned peas, canned carrots. It's very different from a very fresh fruits and vegetable. So in order for the person to actually function at a highest level, it is recommended to have 2 to 3 times more than recommended daily serving. Which means you gotta take what? 6 to 10 servings of vegetable and 4 to 8 servings of fruit. That's a lot of fruits and vegetable. I don't know about you, but I don't think I can consume that much. Now, there's also a problem in nutrition value of our fruits and vegetable. In 1940s, there's more nourishment in fruits and vegetable compared to now. So for instance, compared to 1940 and 1991, the minerals inside these vegetables are deficient by 49, 16, 24, 27, 76%. So what it means is even though you think you're eating good diet, by having good fruits and vegetables, you're not really getting enough nutrient into your system. Why is that? Well, there's a lot of rapid farming, which leads to soil depletion. With soil depletion, there's not a whole lot of minerals into your body, okay? So you're thinking, well, I gotta take 2 to 3 times more fruits and vegetables, but yet I still don't have enough nourishment. How do I get more nourishment into our system? Another thing is, quality of food is very important. A lot of times, people tend to eat a lot of these kind of foods, okay? Eating fresh fruits and vegetables along with good source of fish, avocado, omega-3, omega-6, are these type of food actually help lower bad cholesterol, LDL, and also reduce inflammation. Now, when people come into our clinic and they're having a lot of joint pain, one of the questions that I ask is, do you take supplements? What kind of diet do you eat? And if I see them eating a lot of trans fat, pizza, fried food and stuff, I say you need to cut that down, okay? But if you're eating good food and diet, then your body has more chance of healing well, because these type of food causes inflammation and also raise sugar level, okay? Now, our ancestors had to fight to survive from predators such as tigers. And when they get stressed out, it's because they're getting attacked by predators. And when they get attacked by tiger, they have 2 options. 1, fight. 2, run. But all of these activity requires what? What does it require? For them to move. When they move, they burn sugar. When they burn sugar, there's no excess sugar in your system to cause problem. In our modern society, we're not being attacked by tiger, but we have a lot of other stresses. Stress is family, stress in money, stress in health. And all these stresses actually creates turmoil in our mind. But then what do? Do we run? What do? We sit down. And when we sit down, you're not using the sugar. Where does the sugar go? It stays in our bloodstream. It actually prevents the sugar going into your body, so the insulin starts to get blocked, causes insulin resistance, leading to diabetes. Okay? So our stress level in our modern life is very different compared to when we're ancestors. We have lower nutrient in our food. So when our food has lower nutrient, we don't have enough things that could actually cause more helpful to our body. Number 2 is we have a lot of harmful and toxic effect of unhealthy diet. 3, sedentary lifestyle. Okay? We tend to spend more time sitting in front of the computer compared to even in the 80s and 90s, right? Computers and phones seems to rule our life. And it's unfortunate because it actually doesn't burn our calorie. Plus, it affects our posture. Our body's doing this, which is very bad for our spine. 4 is chronic stresses. A lot of stress affecting body. And number 5, body's inability to absorb nutrients due to some digestive challenges as well. Okay? Now, when I talk to certain people about, you gotta take some supplement, they say, I don't take pills. That's what they say. I don't take pills. And also, I eat good diet. And I said, good for you. You should be eating good diet, even though you take supplements. Okay? Supplements are called supplement because they supplement your good diet. Using multivitamin, this is very important. One of the variety have way too much deficiency. You take one vitamin per day, it should be good. You hear that all the time. Magic, right? Isn't it great? Just one pill. Also use capsule versus tablet. Tablet, they put too much pills, too much binders and fillers and flow agent that your body cannot absorb. Okay? And also you need to look at full disclosure label. Behind the label, you have to see what's in there and why it's in there and what effect it has. And it has to also contain trace minerals as well. Okay? Now, avoid low quality form that has carbonate and oxide, which I'm going to talk to you. Best mineral has citrate, aspartate, glycinate. And also B complexes should be activated source, which means it have 5-phosphate. And the vitamin D3 should be non-synthetic. And the highest multivitamin does not replace quality diet, and it doesn't cause GI upset. Now, no offense to Centrum. Centrum's well advertised. A lot of people look at Centrum on TV and they say this must be good because it's on TV, right? But it says 1 tablet, which is deficient. It has calcium carbonate, as I mentioned, that's actually a very low form. It has DL form, not the actually organic form. Riboflavin B2 is not an activated form. It also has filler and artificial coloring. So there's a lot of stuff that your body is not be able to absorb. In the labeling of the B complexes, it says B2 and this kind of nomenclature, but it's not activated. Where's the trace mineral? Okay, and it's only in one a day. So when we look at the multivitamin, I like to choose that has no allergens, no gluten, no artificial flavoring, no coating, no GMO, no binders, and none of these toxic effects. This is what you call full disclosure. So for instance, vitamin C, a lot of times they say absorbic acid. Okay, absorbic acid is a kind of a general term saying vitamin C, but you got to look at absorbic palmitate, more specific form of vitamin C. Also, if you look at B complexes, it says riboflavin 5-phosphate activated B2 form. So why activated? When we take it into our system, your body has to use energy to actually absorb it to the intestine. And if you don't have that activated form, your body doesn't absorb. It just spills out of your system. B complexes are very important for your nervous system, nerve function. That's why when I, as a chiropractor, treating people's spine with their nervous system, I say you need to have good B complexes. Selenium, copper, manganese, these are all very important for growth of cells, building proteins, healing, really good stuff. And this supplement, you take 3 capsules per day. Okay, not 1 a day. And they're in capsule form. This is called full disclosure. You can see the labeling is completely different. I take a lot of supplements to help my body, but I don't take any supplements. I take supplement that actually helps my body. Now, as a chiropractor, I treat people's spine. And our goal is to make sure our spine is balanced. But when your spine's like this and it's putting pressure on your knee, it causes a lot of wear and tear to the cartilage. So with the cartilage wear and tear, it causes degradation of cartilage over a period of time. So you can see from, grade 1, this is normal, grade 2 starts to cause tear, 3, more wear and tear, and 4, bone on bone as well. But the thing is, our nutrition to our joint is not dependent upon blood flow. It depends on synovial fluid. Synovial fluid is basically produced by your blood vessel going to your lymphatic system to absorb and cause nourishment. So how do we make sure our synovial fluid is actually functioning optimally? Is through your proper metabolism, your digestive tract. When you eat your food is broken down to sugar molecule, and that sugar molecule produces something called GAG, glycosaminoglycan. That actually produces heparin to cause cushioning to prevent any further wear and tear. Now, if you're eating bad diet, you're smoking, drinking, and not having good nourishment, do you think your cartilage is going to get proper nourishment? Not at all. So sugar metabolism creates this kind of thing to create cushioning for the knee. So I recommend people taking glucosamine, chondroitin, MSM, collagen, hyaluronic acid. Okay? Now, some people may think I'm crazy. I have a handful of supplements that I eat after I take good diet, and it helps me. I've been a martial artist for over 44 years. I do a lot of kicking. I still kick. And the thing is in order to do that, we got to make sure our body, our joints can do that as well. Now, I'm going to talk about IV drip treatments. Now, IV basically stands for intravenous, meaning delivering fluid, medication, nutrition through a bloodstream. Now, people say, well, isn't that kind of scary? Isn't that dangerous? Doesn't that cause more harm? And there's definitely concerns of that. But I'm a true believer in IV. I love IV. Okay? I get it done every 2 weeks. It actually helps rehydrate, builds my protein. It's good for my system. There's a 4 type of IV that Century Dermalonge does. Why do we do IV? It actually is used in the hospital setting for people who are ill, right? But nowadays, people are using for wellness, just like supplementation. The key thing is it actually goes into your bloodstream, bypassing your gut. So if you have some digestive issue or your body cannot assimilate some of the nutrition, you use IV to actually help nourish it. IV should be done properly. It can't be done just kind of like, let's give it a try. Don't do this at home by itself. And the benefits of an IV is it delivers effect immediately. It bypasses the gut. It creates instant hydration, causes the mineral in your body, electrolyte, to increase, which also help out with your cellular function. It bypasses gastric system. Okay, it's beneficial people for who cannot absorb nutrient through your gut. It's very, very convenient. It literally takes me, when I do it, my veins are pretty big, it takes me 25 minutes. Some people who are smaller, it may take them 30. My wife takes about 35 to 40 minutes. And the key thing about this company is these IV, which I'm going to talk to you specifically, are produced in their lab, drug production premises, by a qualified pharmaceutical professional. Okay, it's not done by anyone. Okay, every bag has a DIN number. It's Health Canada approved. 100% vegan. They're never tested on animals. They're 90% stability, and they're made from a high-grade plastic without PVC. Because the standard's there, it actually is very, very safe. These systems are isotonic in concentration. So what it means is our blood vessel and the IV concentration are equal. So if there's too much salt in the IV, it creates the blood cells to dry out like a raisin. But if there's too little salt in the IV, then it puts water into the blood cells and it causes bursting. We don't want any of that. So because it's balanced, it creates isotonic balance between the blood cell and the fluid. Okay? There's even electrolyte concentration, so it prevents fluid retention. No swelling in your ankle, no swelling in your wrist. It has the highest source of vitamin, just like I told you about the activated form, okay? And it's done in 25 minutes, like someone like me. Now, it is done by licensed nurse, okay? So a person can't just say, hey, you know what, I want to do IV. Let's do it. Let's pop it in. It doesn't work that way. You need to fill out the form. We gotta get some blood work done. Just check it out. Able to do it. Then we have a nurse who actually administers this. Now, who should never get IV? People who are constantly influenced of alcohol and drugs. No. Some people say, well, I drank a lot. I'm always drinking, so I need hydration. And they're always influenced in that. I say, that's not for you. People who are breastfeeding and pregnant ladies should consult your doctors. This IV is more for wellness, and it's not to treat severe chronic illness. This is not really recommended with people who have chronic heart and blood pressure issue that cannot be controlled. Now, there's 4 types of IV. First one is boost IV. So it has a lot of the electrolyte to replenish lost electrolyte and rehydrate. So what it's used for is for people who are quite dehydrated. They're playing in the sun, sweating a lot, and they're not drinking enough water. And this boost allows optimal rehydration fast, rapidly. Okay. Second is energy. If you're under a lot of stress and your energy level is really reduced, there's a lot of good form of B complexes, but also it has levocarnitine and dextrose, which is for cellular respiration to actually increase ATP. Okay. And the energy is used for people who are actually lethargic, sedentary, can't seem to kind of lose weight. It is actually good for people who's also working out. I use it to support my weight training and martial art kind of endeavor. The third type of bag is Radiance. This is actually a very, very good IV bag. I like using this. And a lot of times people say, well, Radiance, is it for just skincare? Yes, it's good for skincare, but guess what? It's good for joints too. It has a high source of amino acids that actually help repair protein and collagen. I noticed an immediate effect when I got the Radiance. It really helped out with my stability of my joint and muscle, and also my recovery from training is much more optimal. So this is actually very good for my patients who are getting joint treatments. When people are getting some skincare, laser, pigmentation, all these treatments along with Radiance, but also to help build up collagen along with supplementation as well. Okay. The last is immune IV drug. People who are very ill, always feeling sick, feeling tired, fatigued. I had a patient come in and go, I need my back treated, but I've done everything, it's not really working, and I sense their energy just so dropped. And you know what I say? Even though I want to treat you physically, your body's not ready. You need treatments to actually enhance your internal energy, and this is what it's for. And typically I would refer people who have really, really low energy to my traditional Chinese medicine doctor to get some treatments, get that qi up, get some immune IV drip going. And then once the body becomes a bit more balanced, then I can put stuff in their body to help stabilize the body. Treatment really works well with TCM treatment, internal treatment, massage, and even with chiropractic care as well. Okay, so I just want to show you a quick video of IV treatment done for me. That's how it is. You're sitting down on that lounge chair. It's very relaxing. And they put the IV, actually a nurse, and she's trained. She's done 22 years of IV therapy in hospital. For her, it's a walk in the park. But before we get the IV done, I actually had my health assessed. I send my information blood work to make sure there's no contraindication, which I know for sure I don't, okay? And from there on, I got the clearance to get the IV done. How often do I get IV done? I get it done once every 2 weeks to 3 weeks. Does that mean that I don't have to take vitamins? No, I still take them. Does that mean that I shouldn't eat healthy food? No, I still eat healthy food. 80-20 rule. Do 80% good, 20% you can cheat, okay? But do all the things that's right, then supplement with good supplementation, and every once in a while supplement with IV. So how do I know if I really need IV? Okay, as I mentioned, what are 4 things that you can indicate they're healthy? First, I'm testing you guys. Number 1, structure. Number 2, skin. Number 3, cartilage. Number 4, hormone. Your skin tells a lot. Century Dermal Lounge has a really cool machine. It shows all these different markers and it rates it and shows what your deficiency is. Another way of checking your structure is your metabolism. In-body analysis, measuring your lean muscle mass, percent body fat, and from that, we can actually use that to actually cater certain exercise need and nutrition to make your body stronger. First and foremost, what can your body do to heal? And once you're healthy, then we just need to create a good habit, good nutrition, and stabilize your whole body as well. I'm actually quite happy that I'm able to share this information with you. But otherwise, thank you for your time, for coming. And I'm not a scary guy. You can talk to me whether or not this would be beneficial, and we'll go from there. Thank you very much for your time.